My name is Naima Ramos-Chapman, and I am the Associate Editor at campusprogress.org and pushback.org. And we're here today with Shalini Pammal, an undergraduate who supports Doctors for America, to talk about the Affordable Care Act, a historic piece of legislation that recently celebrated its 3rd anniversary and, when fully implemented, will extend health care to millions of Americans. Shalini is here to refresh us on some of the important aspects of the Affordable Care Act, as well as some of the new provisions that we have to look forward to. Thank you for joining us. So my first question is, many people do have trouble understanding what the Affordable Care Act is and all the parts and details in the way it helps Americans. So I'm just wondering if, in a nutshell, you can just tell us exactly what it is and how it will help millions of Americans.
Absolutely. Thank you, by the way. Like you said, it's a historic piece of legislation. It's also a massive piece of legislation. So understandably, people have a lot of misperceptions about it. They're really confused about it. But essentially, being uninsured is one of the biggest barriers to care in America. And so what the Affordable Care Act tries to do is remedy that issue in particular. So part of it is extending coverage to many Americans. Another part of it is ending insurance company abuses. So a lot of times insurance companies will drop people's coverage because they're too sick or raise the prices when they get sick. And those kinds of abuses are stopped because of the Affordable Care Act. And then another piece of it is prevention, and that's a hugely important issue given rising rates of diabetes and chronic illnesses in the nation. So funneling money into programs, community-based programs that really support prevention for healthcare is part of it as well.
So most people have a pretty good understanding about the under 26 provision, which helps young people because it lets you stay on your parents' plans for longer. But I'm wondering if there are any other provisions that may not be talked about as much and that young people have to look forward to coming ahead.
Absolutely. So there are two that come to mind immediately. One is that the law creates tax credits for those who earn around $40,000 a year, and that'll extend coverage to 3/4 of young people ages 19 to 29. So that's a huge deal. And then another aspect of the Affordable Care Act is the Medicaid expansion, which will again cover a lot of young people who are earning, around $14,000 a year. So again, a huge population of young people fall into that category. So.
And how are student plans on college campuses affected?
College campuses actually provide students with a large majority of young people with their health insurance. And so part of the provisions of these health plans require that colleges provide free birth control, free STD testing, free preventative screenings, and as well as covering prescription drugs to a certain level. And another aspect is they have a cap, I believe, of about $100,000 for your health insurance plan. So that basically means that even if you get really sick, you're basically going to be covered under your college plan.
And what about those who attend religiously affiliated institutions?
So to my understanding, one big part of the Affordable Care Act is giving women birth control and giving women access to preventative services like that. And so the Affordable Care Act really shifts that responsibility to insurance companies as opposed to institutions.
Right. I guess coming into the future, do you see how this new healthcare marketplace is going to look like? I think a lot of people aren't too sure because we've never had this. Yeah. It's pretty historic. So if you wanted to talk a little bit about that.
I think a big centerpiece of the Affordable Care Act is the health insurance exchanges. And so similar to the way that we can go online and compare different shoes or compare prices for different goods that we would normally buy online, the online exchange setup would allow consumers to go online, compare insurance plans, see which one matches their budget, what matches what they desire, and really puts consumers in charge of their own health care and being able to have the flexibility and the confidence to choose something that it works for them. And so it's all about that kind of that shift in allowing people the opportunity to really choose.
Right, more options.
Their options and be in charge of their health care.
Yeah, I'm sure a lot of people are going to enjoy the online experience too. So I think since the Supreme Court upheld the Affordable Care Act and deemed it constitutional, do you see any other kind of roadblocks ahead in terms of implementation? Are there going to be any challenges going forward?
Yeah, I think the biggest roadblock, and this has been a constant roadblock since it was passed, has been partisanship and misinformation. And I think that, people are naturally wary of change and naturally concerned, recognize that we're living in a broken healthcare system, recognize that we need change, but then become jaded by partisan politics, by not understanding this massive law. And so I think it really requires education. It requires like a culture shift and allowing people to know what their options are, what they're going to be receiving, like the new provisions that are coming up, and really dismantling all of the misinformation.
Right. If someone wants to learn more about the Affordable Care Act, where should they go to find that information?
Well, we live in an information age, so the internet is actually a great place to find reliable information. And I would suggest Doctors for America, for one, has plenty of online resources that really break down the myths and facts about the Affordable Care Act. And especially for young people, Young Invincibles is another organization that is really focused on issues that affect young people. And so they've got plenty of information about college plans, about what to expect going forward, about how you can get involved in advocating for health reform and what you should know.
Rerouting a little bit, has the Affordable Care Act, will it affect you in any personal way or anyone you know?
Yeah, for me, I'm an under 26 female college student entering the workforce, really excited and gung-ho. And for me, the Affordable Care Act is really all about having that sense of security and knowing that I can be on my parents' plan. And even if I make a certain income, starting out entering the workforce, I can have the options of being covered because of the provisions in the law. Young people are the population that often are most uninsured and get sick, and so being able to have comfort in knowing that my community is looking out for me and the nation is looking out for young people is really important.
Thank you so much for joining us. It was a great refresher, and you kind of hit all the key points, and hopefully it was helpful for you all. But and if you want to learn more about the Affordable Care Act, of course, you can look at Doctors for America and then also visit campusprogress.org.
Thanks.
Thank you.